First aid for sunburn involves immediately stopping exposure to direct sunlight. The patient should be moved to the shade, given plenty of fluids, and if possible, administered non-steroidal anti-inflammatory drugs orally. Monitor the patient's condition and watch for all described signs of shock. In sufficiently serious situations, this may involve either general overheating of the body, such as heat stroke, or a significant degree of skin damage. This can also cause intoxication accompanied by an increase in body temperature. Strictly speaking, it is the same kind of intoxication. Therefore, the patient must be given plenty of fluids. Of course, taking a shower is also possible, but the water temperature should not be too cold. Still, in such situations, it is better to use cooling hydrogels and dressings. These include lioxazine and Armagel. The onset of sunburn symptoms usually occurs with a delay, appearing 12 to 24 hours later. Of course, it is accompanied by redness and unpleasant sensations, such as itching. These symptoms usually subside by the second or third day, but sometimes it can take until the 7th or even the 10th day. It ends with peeling, or the skin may flake off. As for more severe burns or prolonged sun exposure, it can indeed lead to second-degree skin damage, which is the formation of blisters. These will be accompanied by severe pain in the affected area. Symptoms of general intoxication are possible: headache, weakness, nausea, vomiting, chills, and fever. Again, I would like to remind you that in severe cases, signs of shock may occur. This includes clammy and cold clammy, cold sweat, clammy, cold skin, paleness, and even impaired consciousness, which can be quite serious. The treatment of superficial or limited first, and second-degree burns is usually conservative, typically involving the use of wound dressings and creating a moist, healing environment for the affected area. The use of topical antimicrobial agents is possible in order to reduce the number of local infectious complications. Short courses of hormone-containing glucocorticoid ointments are used, as well as gels with non-steroidal anti-inflammatory agents, cooling hydrogels naturally, lioxazine and Armagel, and ointments with silver ions such as algosulfan. Do not forget that all burn victims should receive painkillers, non-steroidal anti-inflammatory drugs, any analgesic medications that you have readily available, as well as antihistamine. As painkillers, analgin tablets, pentalgin, and ketanov are used. If you have them, ibuprofen and paracetamol can also be used. Antihistamine medications, first-generation drugs, can be used. Suprastin, Tavigil. Claritin can also be used. The first and most important aspect of providing assistance is anti-shock therapy. Anti-shock therapy involves giving non-carbonated water, preferably mineral water, in an amount from 1 to 1.5 liters per hour. If you don't have access to such water, you must add 1 teaspoon of salt and half a teaspoon of baking soda to 1 liter of water.